Welcome to Prognosis, the most cost-effective, comprehensive EMR system for your pain management practice. This system has been designed to give you ultimate peace of mind and works very nicely with a tablet PC. You'll see here I've logged in as Dr. Marcus Welby, and at a quick glance I can see a nice summary of my inbox messages divided up by category. Red items are past due. I can also see driven off my schedule, the appointments that are coming to see me today, why they're coming in. I have a nice continuously changing status. So as patients walk into the waiting room, the front desk checks them in, I'll see that they've arrived and I'll know what room number they're being taken to. If my MA is currently with a patient, it will automatically update the status because it knows the MA is accessing this patient's chart. As I complete my encounters, move on to the next person, they'll say complete. As soon as an encounter is complete, the ICDs and CPTs go right over to the practice management side for the biller to submit. If I'm not able to get to everything today, which is very often the realistic case, I always have an open encounter tab that I can view all my work in process. These are all the charts that I still have open that I have not signed off. They could be from earlier today, they could be from yesterday, the day before. I can go back to any of these patients, finish what I was doing, and when I sign off their chart, they'll be removed from this open encounter list. Typically, anything that's in this list is not being billed, so it's in my interest to keep it as short as possible. Other areas of interest are these buttons across the top. This first button is my ARA Meaningful Use dashboard. Lets me see very quickly at a glance where we are in terms of meeting our meaningful use and how far we are from meeting that goal. I can see exactly the areas where I might be deficient that I need to improve, and I'll also have a similar type of dashboard for the individual patient that I'm working on later. If I'm ready to work on a patient, Jane Kim, she's here for low back pain. She's in room 12, currently with the MA. I can simply click on her name to go to her clinical face sheet. You'll see here at a glance I have this nice overview of what's been going on with this patient. All her allergies, past medical history, past surgeries, current medications, social history, an area for personal notes. This is not a part of the medical record. It allows me just to carry on a conversation. Here I can see her review of systems, only showing the positives. Problem list relating to pain management, and a list of the procedures that we've done. But this is all completely configurable, could be laid out differently. This information was taken originally by the MA and has just carried forward each visit. Anything with a yellow background indicates it was here prior to today's visit. As we start to change information today, you'll see the colors will change. So you can actually go back in time and see a snapshot of exactly how this face sheet looked at any point in the past. On the left-hand side, I have a nice workflow. This is also completely configurable. I can look at the patient's document list, see everything that's in her chart, quickly review her previous progress notes, radiology results, letters. If my medical assistant has taken vitals, I might want to just come in and take a quick look at that. I can see the vitals have already been taken. I can compare historically how her vitals have changed, trend the data over time. Even though I can go anywhere I want to in this list on the left-hand side, if I wanted to do a prescription or do an assessment, I could, or I can simply follow these arrows. Down at the bottom right, I have a green arrow that says HPI. As I come in here to my HPI screen, it pops up a list of the most common reasons that patients come to see me. From the left, I can see the reason why the appointment was made. I can just simply start to type what those items are. Can be multiple things that the patient has. And as I choose those complaints, the system will give me a nice set of questions to document. Documentation can take place either with the templates, or you can jump right down to the patient's note field at the bottom, and you can use Dragon Medically Speaking. You can do handwriting recognition. The templates, however, will create very nice notes, so you can very quickly indicate what were the circumstances, when did this happen, what's been the location where this might have happened, and what's been the duration of this, and was it a sudden, when running, and what's the frequency of the pain, how would she describe it, And the radiation, does it radiate? Maybe perhaps into the left shoulder and into the left upper arm. The worst pain that she feels versus the best. And what's the average? You'll notice that if I choose the headache problem, then I see a different set of questions on the right-hand side. And I can check these off with the defaults if I want to, and then just mark whatever particular items about this. Notice I also have a copy button in the upper right, so if she's been here before, I can copy something from a previous visit, just make very quick changes and move on. Otherwise, I can just use these green arrows down at the bottom to move on to the next logical step. A review of systems, in this case, I can see that this has been brought over from before, and I see where she had a problem with cardiovascular, each of the areas with a red box. So cardiovascular, I can see what those particular areas were, musculoskeletal, etc. So just by clicking on the item, I can see the details to the right. Notice the yellow color indicates it was copied over automatically. And if there's anything else that she notices today, then I can mark those areas. And the color changes from a yellow to a gray. The next green arrow at the bottom right is taking me to an objective exam. I can choose a detailed physical, I can do a follow-up physical. I can come down one at a time, or I can check everything off very quickly with all the defaults. Except maybe under general, the patient is in moderate distress. You'll see that you always have areas to the right where you can put in any comments to modify any of the questions, but you also have these binoculars where you can jump into your favorite phrases. As I mark these areas, perhaps going to the cervical spine, then I'll see the details to the right. And any abnormalities that I mark will be clearly seen. Each organ system is going to be detailed on the right. Sometimes it's nice to be able to annotate diagrammatically. So in that case, I can always jump into my library of diagrams, choose the appropriate diagram. Perhaps the patient describes shooting pain here and here. So just using my customized icons, I can place these items anywhere I need to, and it geographically labels where that part of the anatomy is, and I can put in my notes there. If I need to pull up the right side of the head, indicate some swelling on the back of the skull, I can mark those areas as well. Everything that we're doing is going towards creating our progress note. Notice that just based on the point and click, the system has created a nice note for us. So just based on this, you can get actually nice sentences created, but you can also put your mouse in here if you need to move a sentence or a paragraph around. It also brings in her allergies, current medications, family history. In the review of systems, very easy to see where the positives are, showing in bolded, or they can show in red if desired. And as I come down to the objective exam, I can see all of this data has been nicely compiled just based on our pointing and clicking. I can also have my diagrams in here if I would like. If I'm ready to do an assessment on this patient, I can see that the system can help me to choose likely ICDs based on the complaint. However, I may not agree with these, and I can always jump into my preferred ICD codes and choose other ones that I think are more appropriate. I can search by description or by code, and if I decide I want to also look for the word migraine, notice I see a few things in my preferred list, but the book will allow me to jump into the entire ICD database, and I can choose from there as well. Anything that I feel is going to be the primary today, and I'd like to get rid of these two, which the system originally chose for me, I can easily get rid of those. I can reorder ICDs as well. If I'd like to break these out by separate assessment plans, whichever is highlighted, as I fill in the boxes to the right, it'll allow me to accomplish that. So for my assessment, I can either handwrite, do voice recognition, typing, or I can jump into my preferred phrases. You can have your own phrases in here, but we already have very good ones, and you can easily choose from these. To add your own, you just simply click on the plus sign. So perhaps that's my assessment for the plan. I'll click on my little binoculars here and choose my appropriate plan for the lumbar spine. And I could also include a document which maybe justifies the reason for doing a certain procedure, or maybe we want to get a CT scan done. So very quickly I can pop that in. And then for the classical migraine, notice this blanks out. And maybe I just want to say send to Dr. Jones, neurologist. I can indicate from my front desk this patient needs to come back and see us in 1 week. The reason why, maybe we want to have a pre-op. This will pop up in front of the front desk before the patient even gets up there, so they'll know what needs to be done. Down here you can use these buttons to indicate that you'd like to get a prescription prepared, a lab, radiology, or consult, and this will also document in your plan. E-prescribing is also built in, so you can either refill from medications they're already taking, or you can prescribe something brand new for that patient. All of the drugs are in here, kept right up to date. It'll remember your preferences. It has formulary status checking. I can quickly add that medication, and from here I can send it directly to the pharmacy using my ERX button, or I can print it out and give it to the patient. Notice that the medication list has automatically been updated with the Lyrica, and we can also see in her past medical history that the assessment has been added to that as well. If we want to see what we can bill for, we can come into our Enum Calculator. The system will pull up the appropriate types of codes depending on the type of visit, and it's keeping track of a tally of the HPI bullets, the review of systems, and the physical elements that we've covered. You simply have to make a subjective decision. Was it minimal, straightforward, low complexity, moderate complexity? Based on that, the system will give you a suggestion, in this case a 99214. To qualify for a 99215, we just needed to review some family history, social history, and we could have gotten to that next level. So I can confirm what it's highlighted for me, or I could override it. I could go back and answer the questions, or perhaps we spent more time with the patient. We can indicate those things with the time factor. At this stage, perhaps I'm done with the patient and I want to close my encounter. So I go to Encounter Close. We have a nice summary of what we've done. We have our follow-up for 1 week for the pre-op, and I can indicate that I'm all done with this patient and ready to close. As I close, it'll give me alerts, things that I usually like to get done before I close the encounter. With regards to the meaningful use, it'll tell me if there's anything that I'm missing with this patient, and I can go ahead and take care of that. Otherwise, I'm done with this patient and ready to move on to the next person. As we come back to our home page, we can see Jane Kim is now complete. Her charges have gone over to the billing department, are ready to be approved and instantly submitted as a charge through our practice management module. And I'm now ready to come on to my next patient, Lauren Smith. The demo that you see me doing today, of course, I'm taking a scenic tour, pointing out all of the sites along the way. But of course, as you're doing your encounters, yours will be very much more streamlined, and you'll go directly to the items that you need to do on a day-to-day basis. And thank you for taking the time to take a look at this demonstration of Prognosis EMR.